There's a pilot program in the works for Brooklyn Center residents to help with culturally responsive mental health care. Shannon Slatton sat down with Blue Cross and Blue Shield's Vice President of Racial and Health Equity, Bukata Hayes, to learn more about it in today's Newsmakers.
Well, I guess to begin, what is culturally responsive mental health care?
Yeah, so I think that's a really important framing and concept for folks. One is typically mental health practitioners were trained in one trauma, right? And so culturally responsive sort of mental health care means that you are trained in multiple traumas, sometimes compounding traumas, right? We know race presents and has different outcomes, presents different outcomes within community. And so culturally responsive teletherapy takes that into account, right? The practitioner understands that, is culturally competent, is trained to take that into account in addition to and sort of in concert with the mental health issue that they're being seen for.
There's some special services going to be made available to Brooklyn Center residents. What will that look like and what will that be?
Absolutely, absolutely. So we've partnered, Blue Cross Blue Shield of Minnesota has partnered with Hurdle Health. They deliver culturally responsive teletherapy care. They'll be working with Brooklyn Center residents. We know it's been a tough couple of years, both with COVID and the outcomes that, the disproportionate outcomes we've seen in Brooklyn Center. Then, of course, the killing of Dante Wright and the aftermath. And so really trying to hone in and provide some services for folks within Brooklyn Center to engage in, to begin that process of healing, right? And so one of the ways they can connect with them is through the Health Expo on August 13th. Representatives from Hurdle Health will be there, and then also there's another event that they'll learn about at that August 13th event that will happen the following weekend, and that's the August 20th event. That's more of a sort of know more about the services.
All right, and if I understand correctly, it's actually like telehealth or teletherapy.
Absolutely,
so you
yes.
can meet people where they are.
Yeah, so it's virtual. So I think that's the other thing that's important right now as we think about culturally responsive care. It's also the care, but it's also who's delivering that care, and we want to provide folks with an opportunity to engage with more BIPOC practitioners and providers. Virtual care, teletherapy, culturally responsive teletherapy is one way.
All right. And how do you hope this helps the community collectively moving forward?
Yeah, I think there's been a lot we've been through, and so part of it is how do we begin to understand sort of how much there is. This pilot is one way, and as Blue Cross Blue Shield of Minnesota, we hope to learn and then provide this service, a service like this, throughout our membership, right? But I think part of it is to simply address the need that we know is present, and that is how do we deal with the stressors that have been the last 2 years here in Minnesota, and then also, of course, in Brooklyn Center.
Lots to look forward to. Bukata Hayes with Blue Cross Blue Shield, thank you for being here today.
Yeah, thank you.
Find more local news stories at ccxmedia.org and follow us on social media.